Hey, John, our cameraman just came back from shooting a healthcare video in Cincinnati, and he brought us a couple of bottles of champagne from the locker room.
Thank you, Tom Brady.
Welcome to CareTalk, your stately home for healthcare business and policy debate.
Home.
No?
Nope.
I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
So, John, I was thinking, what would be the most cliched thing we could do for the end of the year episode?
I think we should do an end-of-year wrap with the top stories and the top trends of 2019.
That sounds like an outstanding idea, John. So how about, tell me, what was the top healthcare news story in 2019?
Well, I think one of the top stories in 2019 is the ACA works. If you look at the number of people covered and what has survived, all of the fake news, all of the attacks, all of the undermining, the lack of legislative support, the attacks from the White House, the attacks from the Republicans, rates are going down. It's one of the few good news stories about pricing in U.S. healthcare. Down 4% this year, down a little bit from where it was down last year. I think the engineering around the AC actually works in spite of criticism from people like you.
I'll tell you, John, even I couldn't make the prices go up. So I do think it is saying something. You know, I'd have to say another story that came out of nowhere this year was the deaths from vaping. Unexplained deaths.
Horrible.
At least 50 deaths, thousands of people sickened from it, and really haven't gotten to the kind of the root cause of it yet. So to me, that is a big thing that's been going on this year. I like your story better. That's like a happy, feel-good story. Mine's a sad story, but I think they're both there. Now, John, I got to ask you though about pricing, because I've always heard you talking about pricing going up, and like drug pricing. So about drug pricing.
Up.
Yeah. So
That's
explain to me.
Pretty straightforward.
Okay. Well,
And?
drug pricing. You said ACA premiums are going down. The drug pricing, is that under control too now?
I don't think that's much of it. It's a rhetorical question,
Okay,
David.
John. So
As
don't
you
answer
know,
it then.
We in the U.S. refuse to take advantage of the power we could have to negotiate prices directly with pharma or to regulate reasonable prices. I think we need to protect the very high-cost innovative drugs that are helping you with your behavioral issues.
Thank you, John.
But the simple chemical, the basic stable chemical compounds, the pills and the capsules that people are on every day, the people with chronic disease rely on, that have patents that have been created decades ago, in some cases, 50 or 60 years old, those prices are still going up. And it's unacceptable. We are the United States is a profit-making machine for big pharma, and it shouldn't be that way. People can't afford their drugs, and people like you got to get on, get involved.
So, John, the people like me, which could be like me, like the Congress people and the senators, those are more like you, a little older, more stately. They actually, in both houses, there were drug price bills introduced. Pelosi said they're going to negotiate.
We're on the road.
And Grassley's actually saying that Senator Mitch McConnell is stopping things and preventing President Trump from having his triumph.
Look, I think there's a lot of interest on both parties to actually do something on drug pricing. It is one of the most popular political issues for any politician to be in favor of. But Big Pharma still spends more money in more districts, in more states than any other industry in the U.S. And I don't think anything is going to happen. And it's crazy because we could have a more reasonable drug pricing regime and still protect innovation and protect people and provide more access to people to drugs they need.
All right, and stick it to the foreigners, right? Kind of like in the Gulf War. Make the Kuwaitis pay for it.
Fair trade.
So, John, how about what's the biggest healthcare deal of the year? We did story. Now, what's the biggest deal?
Well, I think the one that Marcus Osborne shared on our podcast that you probably forgot.
Las Vegas, John. I forget nothing in Vegas, but I thought it stays in Vegas.
The healthcare initiatives for Walmart. And I think the fact that Walmart can provide primary care services to people for cash prices that are less than the deductible in many cases that people pay for visiting a doctor or a nurse, getting tested, getting evaluated, or even getting access to mental health and counseling services. That's a game-changing deal. And I'm stunned that even though he sat between us, you missed it. But I think it
John,
will
it was
change
Vegas.
primary care.
There was a lot to look at out there, so it's including our camera.
I was focused on healthcare.
You were, John. Always on the job. Okay. Now, John, the thing is, I would say that's a big one. Big deal.
Thank you.
Okay.
You
I would say I got it. But if you want to really think about a deal, I think you kind of didn't really answer the question. That's okay.
Hands down.
But I would say that the big proposed settlement in the opioids crisis of about $48 billion. To me, that's the biggest deal of the year, whether or not it gets done.
It's a lot of money, but it feels like the true bad guys in that settlement, folks who were pushing the drugs like the Sacklers, it seems like, then the Purdue Pharma, it feels like they're getting off easy, and it feels like everybody else who could be pulled in as a potential distributor got associated with it. I think that's a lousy deal. A big settlement should be paid. There's a lot of people who are still suffering from opioid addiction. Many people have died. I'd like to know what's really going to change, and I'd hope that the settlement that you like is actually going to be attached John. To the people who are really deserving.
I'm a little confused. I thought Billie Eilish was the bad guy. Yeah. All right. What else? What else you got for me, John?
So David, you're a technophile.
I sure am.
Let's look at that watch. What was the biggest technology deal with the biggest deal technology in healthcare last year?
I guess the watch is pretty much the same. Although the new ones actually, I think they can stay on. That's the big innovation there. But John, I think the coupling of these watches, wearable sensors with apps like for weight loss, behavior modification, I think that's actually the big deal and has made it.
Why is it a big deal? What makes it different?
Well, because it used to be, you wouldn't want to wear something. It looked like a,
geek like you.
You said it. Okay. So, but now it's something you put on every day and you have it, it's monitoring you. And I think by coupling it with behavior change apps, it let me lose weight last year after having it on my New Year's resolution for a number of years. I actually did it. I did it, John.
Don't believe
it. Also, you never feed me when I come to visit you, so that also probably helped out.
But I think you're onto something, if not about you.
Okay.
That the combination of behavioral apps,
yeah,
of having something that gives you constant information, so you've got a little bit of an information feedback loop, and the fact that there's now some big data tools that are part of these companies like Livongo, where that intelligent decision making and feedback is tuned to you, and you're learning with it as they get better at helping you manage your own chronic conditions. It's pretty attractive, and it makes the wearable industry, which was really kind of a technophile fashion statement, something that actually could be an extension of the kind of care that people need and can access self-care, which is ultimately much cheaper and more effective from a long-term perspective. So you may continue to lose weight if you just start using the app.
Amen, brother. I'll be maybe gone by this time next year. So John, you're kind of a big post-acute guy now. We've saved that one for last. Any innovation at all in post-acute?
Oh, I think it's the continuing insights that came from the bundled payment initiative that CMMI, the Medicare Institute that actually feeds innovation. There's a big demonstration project that looked at how we could reduce costs from hospital admissions and discharges. And what they find is the greatest ability to lower costs and improve outcomes is to lower the amount of time patients spend in hospitals and in nursing homes. And I think that's going to create more and more opportunities for folks to access care in the home. And to the extent that that can be done safely, it's a trifecta win for providers, because they no longer need to spend as much time on the same case, for patients because they can get access in a safe way at home, and it's going to dramatically reduce costs and stop making fun of post-acute.
All right, John. Actually, one important milestone is that for the first time in at least half a century, more than half of people actually died at home as opposed to in an institution like a hospital.
And 75% of Americans would prefer to die at home rather than in a hospital or a nursing home. So that's pretty amazing. Why do you think that is?
I think because the CareCentrixes of the world have helped to make it easier for people to be in the home, and there's a realization that it is under your control. And I think there's some incentives in the healthcare system to try to keep people out of the hospital.
It's really dramatic. 30% of Americans in 2017 dramatically, for the first time, home was the leading place of death where people could die in a place that they choose. And again, 3/4 of all Americans would choose to die at home if they had the option. But that's still compared to 60% in Canada and over 40% in England. So we've got some room to run there, and it could be a real civilizing thing. So I think that is you finally got to a really big story.
Okay, good.
End of year.
Well, that's good, John. So it's winter in New England.
It is,
and it doesn't seem like I look in the sky. It doesn't seem like the lightning round is the right thing to do. How about we call it the bomb cyclone round?
We are in a squall.
Boom.
So, David, how are you going to ring in the new year?
Well, John, I'm going to be in Southern California, so I'm probably going to get nailed by an earthquake or dumped into the ocean, or maybe a wildfire might get me. And you?
Romantic dinner at home with my wife.
So nice. Can the war on terror help healthcare?
Where do you come up with these questions? It has nothing to do with healthcare. The only thing it can help is all of the great research that's been done on concussions because of and suicide and mental health that's come out from the long, endless war that's put too much of our vets and folks who have been on the front lines of the battle into therapy and getting support. I think it's the only thing is that we've advanced research on those areas.
Well, John, I read about they have this bomb sniffer that can also sniff out fentanyl. It's kind of pricey, and I'm not sure it's worth it, but I think it could help.
So, David, you've got some fake arguments. Are you eating any fake meat or oat milk? I think that stuff tastes horrible, by the way.
I'm going to try the oat milk, John. It actually looks pretty good to me. I want to see. It's like oat milk. I thought it was goat milk that somebody just nibbled a G off of before, so I'm going to give it a shot.
I actually think the alternatives to meat taste pretty great. And what people don't get is while they are not so healthy for you right now, there's an enormous movement and a ton of competition to make not just meat that tastes great, but actually is great for you. Look forward to it.
I know, John, at Burger King, I think they fry it up in the same oil with the Whoppers. That's why it tastes good, because it tastes like a Whopper. That's half of what you're getting. John, are you recording your doctor visits?
You ask more intrusive and weirder questions as the year goes on.
Sure do.
Of course I'm not doing that. I do actually write down what goes on in the doctor visit because I do think it's important not just to have a conversation with your doctor, but to note what's actually going on. And I would recommend that as best practice for everyone. You should probably have someone come with you because you probably are forgetting things. I don't know. What
I do. I like to say bring your own doctor when you go to the doctor. That's the best thing you can do, BYOD. I think it's kind of like when people are filming a police officer doing something. It's like, I'm going to get my phone out and put it in the doctor's face and help him out.
It's going to really help with the relationship.
Yeah, thanks. Well, that's it for another year of CareTalk. I can already see the headline for next year's end of the year issue. Hindsight is 2020. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. And for those of you who have too much time on your hands over the holidays, remember, #CareTalk. You could have your CareTalkathon via YouTube. Happy New Year.
Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.